Welcome back, everyone, to Dr. Christy Cares. I'm Dr. Christy Matusiak, and this week we're going to talk about sleep. Good morning. How many of you wake up not feeling refreshed in your morning? How many of you feel like you need your coffee 1 or 2 to 3 cups or more sometimes just to get through your day? That's not okay. Generally, sleep issues fall into one of two camps. Those who have a hard time falling asleep and those who have a hard time staying asleep, okay? Generally, I have 3 solutions to these issues, and they fall into the 3 S's: schedule, stress, and sugar. Okay, let's start with our schedule. Sleep hygiene is obviously important. The ability to go to sleep at the same time every night and generally wake up at the same time every morning is important to maintain that circadian rhythm and health of your body in balance. On top of that, though, maintaining a routine is just as important, whether it's meditation or prayer right before you go to sleep, whether it is doing some kind of toned down activity. I highly recommend not using smartphones or computers or tablets right before bed. They emit a blue light that's stimulating to the pineal gland and will disrupt your sleep cycle. Number 2 is stress. The more stress we have in our lives, the higher the cortisol is, and that disrupts how our bodies maintain balance, and that'll lead into the sugar category as well. I recommend to maintain and reduce your stress levels. Simply meditate, write, exercise, treat your adrenal glands with respect and love. Okay, we're going to spend an entire video on stress in a few weeks from now. Otherwise, last one is sugar. You'd be surprised how many conversations I have with patients about this on a regular basis. Okay, if you choose to eat before you go to sleep at night, please don't choose something sweet. When you spike your insulin levels, you spike your blood sugar levels, you spike your insulin levels right before bed, they come crashing down within a couple hours of you going to sleep. And bing, you wake up in the morning and can't fall back asleep because your blood sugar is imbalanced. So if this sounds like it might be you, I sometimes suggest to people have a handful of almonds or some nuts or something on your nightstand in case you wake up in the middle of the night and can't fall back asleep unless your blood sugar is stabilized and you need that satiation. If you do choose to eat before you go to sleep at night, choose a protein or a fat that is going to keep your blood sugar stable as opposed to having that quick spike and fall. Other solutions include B vitamins. Other people sometimes recommend melatonin. Personally, I'm not the biggest fan of melatonin except in certain cases because I believe our bodies are supposed to make our own melatonin. So we can talk about that at a future date as well. Also, one quick thing. How many of you wake up at the same time every day? In the middle of the night, though, not the time that you want to wake up. We're going to talk about that next week. If you're one that wakes up at 3 o'clock a.m. every single day and can't go back to sleep, there's a reason for it, okay? Remember, anything that I discuss is not a substitute for personalized medical care, so please follow up with your practitioner or me if you are local. Thank you again for watching. Please subscribe and share if you found this content valuable, and also comment if you have any other suggestions on topics that you'd like to hear in the future. Again, thanks for watching Dr. Christy Cares. I'm Dr. Christy Matusiak, and I'll see you next week when we talk more about sleep. Have a healthy life and a fantastic day.